Hi, I'm Mel from Ultimate OSCE, and this is a little video on the clinical skill IMinjection that comes up for your NMC OSCE clinical competency test, okay? So for this clinical skill, we're going to pretend it is what it is. It's a 15-minute station where you give a patient an IM injection. So we're going to start now. So before you start the station, gel your hands. Palm to palm, backs of hands, fingers interlaced, fingers interlocked, rotational rubbing of tips of fingers, thumbs, rotational rubbing, and wrists. I'm going to get my medication MAR chart, which will be a community prescription, and I'm going to meet the patients. So it's safe to approach. Hi, my name is Mel, and I'm a community nurse looking after you today. Can I ask what you'd like to be called?
Ethel.
Hi Ethel. Just before we start, can I just ask you for a safety check, what's your full name?
Ethel Jones.
Brilliant. And what's your address?
Number 1, any street, any town, L12 3AB.
Brilliant. And Ethel, may I ask what your date of birth is?
The 1st of the 2nd, 70.
Brilliant, okay. So I've got the correct details for your ID check. Can I ask you, are you allergic to anything? Any medicines, food, plasters, anything like that?
No allergies.
Great, okay. The reason why I'm here today is I'm going to be giving a medication called hydroxycobalamin. Have you had that medication before?
Yes, yeah, I have it every 3 months.
Okay, so you had it 3 months ago, did you?
Yes.
Have you got any questions about the medicine, or do you know what it's about?
No questions.
Okay. Is it okay if I inject it into your arm? Is that okay?
Yes.
Is it okay if I inject it on this arm?
Yep, that's fine.
Okay. I'm just going to lift your top. Is that okay? So I can just look at your arm.
Yep.
I've checked all the doors and windows are closed and I'm maintaining patients' privacy and dignity. I'm just going to cite my injection site, which is on this arm, and I can see that the deltoid muscle is free of any breaks in the skin, tattoos, anything like that, and this will be a fine site to use, and the patient is happy for me to use it. I'm just going to cover your back up, Ethel. Is it okay if I get all the medications together and I come back to you?
Yep.
Okay, I was going to prepare my medications. So, because I've touched Ethel, I'm going to do my steps of hand decontamination again. And I'm also going to don an apron. In an OSCE, it's really important to use PPE to protect the patient from the microbes on your uniform, and also to protect ourselves because we're going to, during this procedure, possibly come into contact with bodily fluids. I'm going to presume that the trolley has been washed and cleaned in the last 24 hours with soap and water. It looks visibly clean. And I'm going to use a sharp spin for this procedure, which I'll put here in a second. I am going to, first of all, gel my trays with, clean my trays with Clinell wipes. So I'm going to clean the inside of the tray first using a zigzag technique. Clean the edges and then clean the outside. Put that down, take a second wipe, again, clean the inside of the tray, clean the edges, and then clean the outside. In your OSCE, you may get cardboard trays or you may get plastic trays. If you get plastic trays, do clean them. You might get one big tray or you might get 2 trays like I have here. I've got 2 trays, so I'm going to use one for preparing my needle and rubbish, and one for actually taking it to the patient. Okay? And put my wipes in the bin. I'm going to need the following equipment for my procedure. So, first of all, I'm going to need a 2 ml syringe. This is intact and this is in date. Put this in this tray here. I'm going to need a filter needle because I'm going to be pretending that the vial I'm drawing the hydroxycobalamin up from is glass. Okay, so if we open a glass vial in the UK, we should use a filter needle. This is a filter needle, or sometimes called a blunt filler needle, and it's intact, it's in date. And I'm going to use a giving needle. If you look on my table, there's two sorts of needle here. One is a safety needle and one is a usual green 21 gauge needle. It doesn't matter which you use. I'm going to use the safety for this particular station. So this is a 21 gauge safety needle. It's intact and it's in date. I'm going to need gauze. I'm going to take one gauze for opening my glass vial and one gauze for tending to my patient after the injection. I'm going to need 2 alcohol swabs. These are both intact and in date. They expire in the future. They're 70% alcohol, so there we do. We have all of those, and I'm also going to offer my patient a plaster after the procedure. The plasters don't have expiry dates on them, okay, but it's intact, and I'm going to put it in the tray now. I'm then going to do the rites of medication. So, before I checked my patient's details, I checked their name, their date of birth and their address. Because it's an outside of hospital scenario, I don't need to check. They don't have a wristband on and I don't need to check their ID. But if they were in a hospital, obviously I would also check their hospital number. Okay, so I'll get my drug and I'll get my chart. So I'm happy that the first rite of medication has been met and I've got the right patient. The next rite of medication I have to check is if I've got the right drug. And the prescribed drug here is hydroxycobalamin, or vitamin B, it's sometimes called. And that's correct to the vial I have in my hand. The right dose is 1 milligram. I've got 10 milligrams and 10 mils. So if I draw at 1 mil, I have 1 milligram. And the route is IM. The vial I have is in date. It expires in the future and there's no precipitate. It's a nice clear vial. The doctor has said that the frequency is every 3 months, which I've just confirmed with my patient. And it's due today's date, due at this time. It's been signed by a doctor. And I'm happy that all the rites of medication have been met and I can go ahead and give this drug. I'm also happy that I've spoken to my patient and she is happy to have it and she's given her consent for it. Okay, so I am now going to clean the lid of the vial. So I'm going to clean the lid for 30 seconds, very thoroughly, to make sure all the microbes are off the lid. So 30 seconds has now elapsed. I now need it to dry for 30 seconds because that's how these work. They stagnate the microbes and the microbes dry and die. So allow those microbes to dry for 30 seconds. I'm going to keep that as my rubbish tray. I'm going to gel my hands, palm to palm, backs of hands, backs of hands. Fingers are interlocked, tips of fingers. Rotational rubbing of thumbs and wrists. And I'm going to don some gloves. Okay, so the first thing I'm going to get together is the syringe and the... Does that need to move it all this way? Is the syringe and the filter needle, okay? So if I open the syringe, I'm protecting the smart site, which is the end of the syringe tip. And at the same time, I'm going to open the filter needle, being very careful not to touch the smart site or the key part, which is the end of the filter needle. And I'm going to connect those two together without touching. I'm now going to leave this in the tray, put that in my rubbish. I'm going to get one of the pieces of gauze and I'm going to open my glass vial. Yes, I know it's plastic, but we're going to pretend for the purposes of OSCE that it's glass, and I'm going to treat it like it is a glass sharp. So with some gauze, I'm going to break it at its point, and I'm going to discard it straight into the sharps bin. I'm now going to get my syringe and draw up the more than the required amount. So I've kept my needle cover there. That down. And I'm going to use the scoop technique for resheathing my sharp. So I scoop. Oh, great, I've resheathed using the scoop technique. I'm now going to swap it over for my injectable needle. Discarding sharps. This is my injectable needle. Again, I've maintained smart site key site cleanliness, and I haven't contaminated it by touching the key part. Get rid of all my bubbles. It's important to get rid of all your bubbles. Very important, because I want to give the patient the right dose and not give them an air bolus. And I'm going to prime my injectable syringe, and I want to give exactly 1 ml. So there is 1 ml. I'll put that in my tray, and I'll also put in my tray gauze, a skin cleanser, and the plaster. Okay, I'm going to retain my vial so I can till after I've given the injection. I'm now going to get rid of my rubbish. I'm going to clean that later. I'm going to gel my hands now. I'm going to take a box of gloves with me to the patient. I'm going to take some hand gel, and I'm going to take a sharps bin as well. Now I'm ready to return to my patient.